Topping our news tonight, an alarming trend. Most of our West Texas counties are now in the red for a high rate of COVID transmission. So listen up. Right now, the virus is on the move here. Take a look at this map from the CDC. You can see most of our West Texas counties here are in the red. That means we are seeing COVID spreading really fast, especially in more populated areas like Midland and Odessa. Now, you'll notice here on the map, Howard County right there is in the pink. That means it's high but close. That means there is a pretty substantial rate of transmission. In other words, in Howard County, that means COVID cases are ticking up. Now, these counties that you see here in the yellow, Brewster, Presidio, Jeff Davis, and Culberson, they have what's called a moderate transmission rate. The only counties with low COVID transmission rates, and there are very few, Glasscock and Terrell counties. They're in the blue. That means that they don't have very much transmission at all, but they are less populated area. Now, this is such a huge concern. That's why we are going to spend some time talking to you about it tonight. COVID isn't just spreading quickly, it's causing massive problems with our two biggest hospitals. Tonight we have team coverage on what they're facing. We begin in Midland with Rachel Robinson, where they are running out of hospital beds. Rachel, how bad is the situation?
Yeah, Crystal, things are pretty bad. Chances are, if you come to this hospital with COVID, you might not have a bed to stay in. COVID cases are surging, and now Midland Memorial Hospital is having a hard time keeping up.
We have no bed availability currently and have been in this condition for well over a week.
And bed space isn't the only problem. Hospital staffing is also an issue. At times, there's only one nurse for every 8 patients, which has local health officials worried.
With the ratios that we have right now, we are stretched to maximum capacity, well beyond what we normally consider to be safe.
The hospital is trying to hire staff to keep up with demand, but the supply of workers is limited.
In speaking with one staffing agency yesterday, they have nationwide 40,000 open requisitions, and they have a staff of about 1,000.
Midland Memorial is so full, it's holding COVID patients in the emergency department and trying to transfer patients to other hospitals. But there hasn't been much luck.
And we've been unable to transfer patients from our facility to other facilities to find them inpatient beds because all surrounding hospitals, including surrounding state hospitals, are in a similar condition that we are.
And without help from the state or FEMA this time, keeping up with demand is more difficult than before.
This time, we are on our own. They are not sending additional nurses or support. We have put in multiple STAR requests and have been told that the state will not be providing those and that we will continue to have to source them on our own.
The hospital is doing all they can to keep up and is in the process of trying to open another 12-bed unit. But at this point, is just attempting to keep their heads above water.
Every patient that walks through our doors, we will work to stabilize, treat the best that we can.
And most people that are hospitalized here were actually unvaccinated.